Morning and happy Friday, and welcome to Lunch and Learn webinar series. My name is Dalia Dragicic, and I'm the Caregiver Program Coordinator for Aging and Independent Services, Health and Human Services County of San Diego. That's a lot of things to say, mouthful. I'm also working in conjunction with the Caregiver Coalition of San Diego, an organization made of many different community partners dedicated to help family caregivers. I will be recording today's webinar for the future viewing, and this webinar can be found on the Caregiver Coalition of San Diego website. Today's presenter is our own, I think it's our own Caregiver Coalition, Veva Arroyo. Veva has been with Sharp Healthcare for 18 years, and she worked in healthcare system for more than 30 years in San Diego community. She is a part of the business development team for Sharp Hospice Care, which is responsible for the advanced care planning program, transitions, outpatient palliative care program, and end-of-life hospice care services. Veva is also involved in several community advocacy groups and advisory boards, such as San Diego County Coalition for Improving End-of-Life Care, like I said before, the San Diego Caregiver Coalition, and the San Diego Hospice Veteran Partnership. She's a busy lady, so she's here today to present on We Honor Veterans. I will be letting Veva speak here in a couple of seconds. At the end of the presentation, there's going to be time to ask questions. I will mute everyone beside Veva and myself, I guess, and we can just go from here. Veva, take it over.
Thank you, Delia. I appreciate that introduction and the opportunity to present to our viewers. This is going to be an overview on We Honor Veterans program. Next, you can do next slide. So what is We Honor Veterans? It's a national awareness and action campaign that was developed by the National Hospice and Palliative Care Association in collaboration with the Department of Veteran Affairs, and encourage partnership between community hospices, state hospice organizations, and VA facilities, along with community resources as well. So the We Honor Veterans focuses on developing the educational materials and resources hospices need to provide better care, and about encouraging better understanding and stronger partnership between hospices, community organizations, and the VA facilities. The program is in its ongoing development and is guided by the following. We Honor Veterans invites or is a pioneering program focused on respectfully inquiry, compassionate listening, and grateful acknowledgement. By recognizing their unique needs, community providers, in partnership with the VA staff, learn how to accompany and guide America's veterans and their families through their life stories toward a more peaceful ending. Next slide. Our common goal. Perfect. Is providing the best possible care for veterans in the best possible manner and setting, while honoring our veterans' preferences. It is important to recognize that community hospices, state hospice organizations, and VA staff across the country share a common goal, providing the best possible care for veterans in the best possible manner and setting. Next slide. So why we honor veterans. 1 out of every 4 dying Americans is a veteran, and a vast majority of veterans are not enrolled in the VA and may not be aware of end-of-life services and benefits available to them. Community hospices can join in better serving and honoring our nation's veterans and be listed on the We Honor Veterans website. So again, a vast majority of veterans are not enrolled and may not be aware of the end-of-life services and benefits available to them, including the Medicare and hospice benefit and VA paid hospice care and services, also palliative care. So We Honor Veterans provides education, resources, technical assistance to educate hospice and other healthcare professionals, such as caregivers caring for veterans, including those whose military service, combat experience, and or other traumatic events may come to light during their dying process. Community hospices can join other hospice providers across the country in honoring our nation's veterans and be listed on the We Honor Veterans website, a resource for patients and family members looking for care at the end of life. It's free for hospice providers to enroll as We Honor Veterans partner, and you do not need to be a member of the NHPCO to participate. Next slide. Oh, right there, that's right there, perfect. Why We Honor Veterans continues, it creates a culture that includes veteran-centric activities, taps into shared value of honoring our nation's veterans, moves from organizations' needs and goals to veterans' needs to goals, and moves the focus from individual organizations to partnerships. The Secretary of Veteran Affairs, Eric Shinseki, has placed patient-centered care at the top of the list of priorities for the VA strategic plan. And by recognizing the unique needs of America's veterans and their families, community providers, in partnership with the VA staff, learn how to accompany and guide them through their life stories towards a more peaceful ending. Here in San Diego, we've provided, through our San Diego Hospice and Veterans Partnership, several LNIC for veterans that were open to community organizations or professional caregivers working with our veterans on these same tools available. For many years, hospices have emphasized patient-centered care, sometimes going to great effort and cost to provide care and services specific to the patient. We Honor Veterans helps to create and foster a culture that ensures a continuing focus on quality of care for veterans and their families. Next slide. Right there, yeah. Focus on the needs. So veteran-centric focuses on the needs and desires and treatment of our veterans, requires veteran responsibility and accountability, depends on communication, coordination, and collaboration among healthcare providers. As we mentioned earlier, many of our veterans may not be enrolled in the VA and may be using community healthcare systems and organizations for their service. So developing a veteran-centric culture is a three-pronged approach that starts with knowing our veterans and understanding their needs, including them in the process and coordinating activities across venues and settings. This focuses on the needs and desires of treatments of veterans and the assessments identified, health issues associated with military service, benefits to which veterans may be entitled is a huge part, impact of military service on veteran and family members, goals of care, honoring veterans' preferences, and then requires veteran responsibility and accountability, equips veterans and providers with practical health information, emphasizes outreach activities, provides veteran and family education, employs advanced care planning and goal setting, depends on communication and coordination and collaboration, which was the third point, availability of patient records and health information, flow of data and information among system participants, clinical services and administrative processes are coordinated. The next slide, the campaign goals are right there, Delia, that's fine, thank you. There's 4 primary goals. Promote veteran-centric educational activities for hospice staff, community, civic, and other groups and healthcare organizations. Increase organizational capacity to serve veterans through a better educated staff with a more thorough understanding of veterans, their needs, veteran benefits through the VA as well. support development of strategic partnerships between community, hospices, state hospice organizations, and VA facilities and staff. And the fourth is increase access and improve quality through organizational quality assessment and performance improvement programs, such as NHPCO's Quality Partners Program. And you can find that on the nhpco.org/quality on their website. Next slide. So what does We Honor Veterans mean? There's again 4 points under this. Using the military, there is a military history checklist or similar format to get a full picture of the veteran's military service. And be prepared to respond to the patient and family needs. Asking about the patient's military service serves little value if the staff are not able to respond to the answers in an educated manner. Partnerships are key to ensuring better communication, coordination, and collaboration, with care of veteran as the driving force behind all activities, efforts, and interventions. Hospices and community organizations should remember that VA is most often a provider of care and sometimes a payer for care. The VA should be considered an insurance company of sorts. So that's an additional layer that some of our veterans may have if they're using community healthcare systems as well. So in collaboration with the VA and NHPCO, it has developed a veteran-specific question, formerly known as Family Evaluation of Hospice Care Veterans, or FEHC-V, to help hospice and community organizations evaluate the care they have delivered to their veterans patients, enabling hospices to monitor and improve the quality of care being delivered to patients by including veteran-specific questions, otherwise known as VSQs, into a post-death survey. Providers gain information that reflects the quality of hospice care delivery from the perspective of family caregivers. So this is provided to all families if someone is part of the We Honor Veterans program. Next slide. So in support of the goals, the wehonorveterans.org, there's 3 points: the centralized information, educational resources, and partnership tools. To elaborate further, the website serves as a platform for partners to gather a wealth of information and resources to better understand all aspects of the program and to assist with their activities. So there's canned resources already available for someone to participate in this program as an organization. The website brings together information from a number of sources. Any user, there are no membership dues, will be able to find out about veterans' needs, veterans' benefits, the VA organizational structure, and download materials and PowerPoint presentations for both staff and community education, such as this one today. Again, partnerships are key to the campaign and its goals. Resources available on the website provide the tools to establish and continue collaboration with other providers, the VA facilities, and veteran organizations. The next slide. And this is an example. The screenshot of the website homepage provides an overview of the content that one would see if they were to visit the website, and how to go about being a VA and veteran organization, or veterans and their needs can also access this, or when they're looking to work with and coordinate care with providers out in the community as well. So there's opportunity to become a hospice partner, become a community partner, such as in the past, the Caregiver Coalition was or is a community partner, and then, or how to become a sponsor as well. And in there, to go a little bit further, there's veterans and their needs. So needs by war or trauma are included, specific populations, veteran stories, the VA and veteran organizations. So about the VA, veteran benefits, working with a veteran organization. The hospice veteran partnership here in San Diego, we do have a veteran partnership organization, San Diego Hospice Veterans Partnership, which meets with the VA regularly, actually monthly. And then also to find VA offices and facilities located here regionally as well as elsewhere. And then getting practical resources like if you were a hospice intake or admission information, how to honor veterans, medical needs, PTSD and psychosocial needs as well is included, spiritual care, volunteer programs, because there is also the vet to vet volunteer program that's available, grief and bereavement, again, veteran benefits, finding local hospices that are part of the We Honor Veterans and the level of the organization. And then it goes into also enrolling a hospice organization and then spotlighting best practices, announcements, and updates as well. So there's lots of detailed information on that website. So again, the web resources, next slide. Thank you, Delia. The presentations included is We Honor Veterans Overview and Partner Commitment. There's basic training for understanding the VA, building a veteran-centric culture, service-related diseases, illnesses, and conditions. That's a great one also for community use to give them a better understanding. The Hospice Veteran Partnership, which here locally we have the San Diego Hospice Veteran and Partnership. Our veteran benefits, which sometimes is often not utilized, but it's great, especially for social workers, to be aware of this resource and how to access those benefits for our veterans and or family caregivers that may not be aware of additional resources through the VA benefits. Memorials and salutes for veterans and caregivers as well is a great one. Next slide, Delia. Again, this goes over what we just touched on previously, the military history checklist, Hospice Veteran Partnership Toolkit, tip sheets, building relationships with the VA, relationship with provider groups, engaging our veterans is a huge part. Veteran appreciation, recognition certificates, which you probably may have seen in the month of November. There's several community outreach. The Caregiver Coalition does a conference focusing on caregiver conferences for those caring for veterans or military services as well. And then there's links to the VA and other websites. Next slide. So the partnership better prepared to, of course, build professional organizational capacity to provide quality care for veterans. That's a big focus. Develop and or strengthen partnerships with veteran organizations, which is great for anyone caring for our veterans, is knowing how to access those resources so that they can be the go-to person when their staff is serving a veteran or family caregiver of a veteran. And increase access for veterans in your community, region, and or state. And network with other hospices or community organizations across the country to learn about best practices and models that are currently being used, and how do we implement those best practices here locally, regionally, or internally with our own organizations. Next slide. So our levels of commitment via the We Honor Veteran, this was created last year, but we've actually added a 5th level. So the first step is recruitment, getting oriented, and commitment, being committed to do so. Level 1 provides veteran-centric education. Level 2 is building organizational capacity. So within your own organization, creating education tools for your own staff ongoingly, and the level 3 is develop and strengthen those relationships, again, internally with your own organization, with the VA, as well as community outreach and community resources. Level 4 is increasing access and improving quality. And the 5th level that was added is very similar, and all of these are ongoing with your commitment to be a part of the We Honor Veterans, whether it's as a hospice organization or community organization, that you are committed to do this ongoing as part of the We Honor Veterans commitment. Next page. And this just gives some examples of the categories of activities as it relates to the levels through the We Honor Veterans. So each of the 5 levels, partner levels, have 3 areas of concentration with required and optional activities. And you can tailor this to your organization or hospice. It's a big focus is always inclusive of education, focuses on educating staff, clinical and administrative, volunteers, and community groups and organizations. A number of PowerPoints, presentations, online courses, and webinars are also available in the educational resources section of the website, or you can create your own and combine some of those tools to meet this criteria. Organizational policies and procedures is the second part. So policies and procedures, education, outreach are developed and integrated into the fabric of the organization, ensuring all staff are able to respond to needs and requests from veterans and their families. You know, as I previously mentioned, for example, having your social workers be aware of resources like, say, for example, Legacy Corps or the VA Benefits Department in Mission Valley. How do we access that? How do we connect our family caregivers caring for our veterans or those that are currently on our service with additional resources out in our own community or here within San Diego County? Or using our hospices that are part of hospice veterans and partnerships who work with the VA and able to collaborate and coordinate care. So the third point was a hospice and veterans partnership. These efforts within the organization are taken into the larger community, locally, So locally, we have the San Diego Hospice Veterans Partnership. Regionally, we have CHAPCA, which is a California state chapter, and then statewide, I'm sorry, is the CHAPCA. So as partnerships are initiated and cultivated to ensure better understanding of veterans and their unique care needs, enhance collaboration and communication between the organizations. So when say for example, when a veteran does pass, that we're coordinating care with the VA La Jolla, making them aware of this, if there is any existing physician appointments, if they're using the palliative care program, or that their spouse, as a surviving spouse, is able to access some of those additional resources and benefits that might be available to them as well. So closing the loop with the Decedent Affairs Department is huge. Next slide. And this was just, again, the recruitment, committing to the program. You know, how to do that. Anyone can do this. Sign and submit the partner commitment form. You know, building professional organizational capacity to provide quality of care for veterans, develop or strengthen partnerships within the VA and other veteran organizations, promote the organization's commitment to serving veterans in the community, expand community awareness of the unique care needs of veterans, and complete and submit brief activity reports to advance to the next level in partnership. So that's always ongoing, an expectation of being part of the We Honor Veterans at whatever speed. You don't have to do it all in 1 year. You can create a strategic plan for your organization and go, implement those pieces as you progress through each level. So NHPCO and We Honor Veterans staff commitments send certificate designating your hospice or organization progression through the We Honor Veterans levels, provides a We Honor Veterans level appropriate logo for use on your website and other printed materials. And I believe even through our Caregiver Coalition, we submitted this back in 2015 as a community partner, or 2015, 2016, I think is when I submitted it for our Caregiver Coalition here in San Diego County. And then assist you in locating and utilizing helpful We Honor Veteran resources, providing technical assistance and being available to answer questions or give guidance when needed. And the next slide. This just kind of goes over, I know we're, again, the levels in more depth, so we can go forward in this, Delia. I think we just touched on that. So what's in it for us as an organization to know that you and your organization are ensuring that the men and women who have given so selflessly receive the support and compassionate care that they deserve. Next slide. And this is just that join us again, and we went over the process to be part of the We Honor Veterans. Next slide. I want to leave this is the website that we spoke about. So you can access this directly. Next slide. And this is just some examples that we, via Sharp Hospice Care, have done out in the community via our We Honor Veterans commitment as being a level with the NHPCO and We Honor Veterans and our San Diego Hospice and Veterans Partnership working with the VA. So on one side, you'll see Dan Gross and holding up a picture. And I don't know if you're aware, that is how Sharp Healthcare started back in the day. So just a little quick overview. The other one is our Pearl Harbor survivor. We did an event up on Mount Soledad a couple years ago through our San Diego Hospice and Veterans Partnership. And then to the right is Nancy, one of our Army veteran volunteers who works for Sharp Hospice Care. And in the middle is a Sergeant Mora, who was on Normandy Beach, and then Colonel Paul was also on Normandy Beach, and we did an advanced care planning program for them. And this again is some of our active duty volunteers with Colonel Paul Burkos, who's 96 years young currently. And that was Manuel, World War II veteran, who attended one of our caregiver conferences in the past as well. And then just some of our other, the Spirit of 45 within the We Honor Veterans or our military working with the VA, is to continue the stories of our greatest generation, that we use intergenerational storytelling for the next generation so that they are aware of what some of our World War II and Pearl Harbor veterans, service members went through, and that their stories continue and their legacies continue and passed on generation to generation.
All right. Thank you, Bella.
That end. Yeah. You're welcome.
Great job. Thank you. And there is an email somewhere with information if anybody has any questions. Am I correct? There is an email. So this is an email that if there's questions or
they can, yes, they can contact veterans at NHPCO to do that, or they, my email was at the very beginning, the first slide.
Mm-hmm. And so this is going to be uploaded on our website, the Caregiver Coalition of San Diego. So you can access that information from the website.
Thank you.
Okay. All right. It looks like we're out of time right now. If there is no question, we're going to end this presentation and we're going to upload it again, like I said, to the Caregiver Coalition of San Diego.org. So the website is www.caregivercoalitionsd.org, and we can find webinars from the past, and this lovely webinar is going to be uploaded there with Weva speaking. And I think that's it for today. Thank you all for logging in, and see you next time. Thank you, Weva.
Thank you, Dahlia.